likely to climb. And for anyone who thinks the worst is behind us, I have an alarming visual that might make you think twice. Let's see it. Louisiana spike in new cases is rising to levels not seen since the winter surge. That's right. It now has the highest rate of new cases per capita in the nation. And its hospitalizations have quadrupled in just the last 3 weeks. Rising cases, rising hospitalizations. You know what's coming next. Unfortunately, rising numbers of dead. And unlike the holiday surge, this time we have the vaccines. All of this is preventable. CNN national correspondent Yvens Laborde is in Jefferson Parish near New Orleans. Suzanne, how concerned are Louisiana officials right now? It sounds like this is really getting out of control down there.
Jim, we're in crisis mode at this point. The Governor Edwards, saying that this was a perfect storm, the confluence of many different factors, including a storm, of course, that could have been prevented if more had been vaccinated prior to this. But Jim, we are at this pop-up vaccination site here at the Oakwood Center, and folks seem to be taking it very seriously. That the people are changing their minds, they're educating themselves, and the healthcare professionals here say that they put some of this on themselves, the messaging itself. And so just take a look at the sheer numbers. I mean, this really paints the picture here. As you had mentioned, Louisiana is #1 now for the number of new cases per capita of COVID. Just the last couple of weeks, 208% increase in those numbers. One of the things that is happening too is you take a look at it, it is 80% of the Delta variant that is making the difference here. And one of the big problems is the fact that there's such a low rate among those vaccinated in this state, 40% having received perhaps one of the 2 doses necessary of vaccination. And so if you take all of that together, despite the fact that there's some 1,400 vaccination sites where folks can get it for free, this is how it is playing out here among those who are not fully vaccinated. Look at these alarming numbers, Jim. We are talking about caseloads for those who test positive, 92% not fully vaccinated. Of those hospitalized, 90% not fully vaccinated. And of those who have since died, that number is at 91% of those not fully vaccinated. So speaking with health professionals here, what is the problem? What do they need to do to turn the tide? Well, I had a chance to talk to Dr. Laborde. He is with the Ochsner Health Group here. He is also in charge of global outreach and this center here. And here's how he outlined where they need to go.
When we look at vaccine and the barriers to vaccination, there are 4 major factors that impact that. And the way that I categorize them is, number 1 is the issue of mistrust. The second one is misinformation. The third is complacency, and that alludes to that fact. And the fourth is convenience.
And so they are trying to make this convenient, Jim, for those here at the mall to get that vaccination. They may expand this pop-up beyond the 3-day window and extend it. It depends on those numbers. So far, looking at 56 who've been vaccinated today. There's still a couple hours left for the mall to close. And those numbers, they sound small, Jim, but they're actually very significant in this community.
Yeah, and those statistics that you were just showing us, Suzanne, the percentage of people who are unvaccinated in the hospital suffering from this illness, it's just so terrible because it was all preventable. Yvens Laborde, thank you so much for that great report. We appreciate it. And joining us now, the Assistant State